You're pregnant and have a headache or fever or pain, it can be difficult to decide how to treat it.
Dr. Hillary Kufal with Wheaton Franciscan Medical Group joins us to talk about this. First off, how safe is it to take acetaminophen or Tylenol during pregnancy?
Well, we've always considered acetaminophen to be very safe during pregnancy. It's our first line recommendation for most people for headaches or fevers. A new study has come out, however, that kind of calls that into question a little bit, raising the question of whether or not it's linked with attention deficit disorder in children.
And basically, that's the next question that we have is the risk involved.
Yes. So taking acetaminophen in pregnancy possibly may be linked with attention deficit disorder. However, the preliminary study shows that only a cause relationship hasn't been definitely defined yet. So basically what we're finding is that in interviews with mothers, people who took acetaminophen during pregnancy, those children have an increased risk for showing ADD signs around age 7.
And we see all kinds of different varieties of this medications in our pharmacy shelves. Is there a difference between taking regular acetaminophen and some of the specialty versions like for the flu or nighttime, that kind of thing?
All acetaminophen is generally the same, and we still recommend people use it for fevers because we know that fevers can definitely cause risks to the baby. This study we have to take cautiously at this point because right now there's no definite link between it. You know, we don't know that acetaminophen causes ADD, but it's something that bears further study and really underlines the point that we just need to be cautious in taking any medication in pregnancy, even those that we generally consider to be safe.
Is there more risk to take it earlier on in your pregnancy or later?
Actually, in this situation, the risk is later. Most medications we consider avoiding in the first trimester, but there seems to be a stronger risk with taking it in the third trimester and definitely in multiple trimesters. So if you take Tylenol or acetaminophen, take it only if you need it. Try to avoid it because it seems that the more Tylenol you take, the increased risk. And later in the pregnancy, the risk is higher.
And as a doctor, would you prefer that a patient run this by you or any other medications before starting something like this?
It's usually a good idea. If you have a fever, we want to know because there may be something more going on. You may have the flu, for example. So it's always a good idea to call. If you're taking acetaminophen and your symptoms are not getting better, you definitely want to call us because we want you to take it as little as possible and we want to figure out why things aren't getting better.
Is there any other alternative that you suggest?
Well, for fevers, we really want the fever to come down. So some people do well with a cold bath, but if it's not responding, you definitely need to take the Tylenol. As far as a headache, try taking a nap, hydrating yourself, doing these kind of things beforehand, massages of the neck and back if it's a tension headache. Always better to start with those indications first.
All right, Doctor, that's some really great advice. Thank you so much for coming to see us today.
Thanks for having me.
All right. Well, do you have a question for our experts? Email them at asktheexpert@today'stmj4.com. You can also leave them a voicemail. The phone number is 414-967-5253.